Good evening, everyone. Hello, everybody. Here we are again for our Facebook Live, and I know that you have all been waiting tonight, but we had some technical issues for tonight, so that's why we haven't started right away. But anyway, again, for tonight, we have our prioritization delegation questions, and we have exciting questions for everybody, especially about emergency nursing. So for tonight, we'll be starting that, okay, or discussing those questions. But anyway, before anything else, I would like to introduce myself again. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students for almost 25 years. And also, I'm a published author. I am an author of the book Simple, Fast, and Easy NCLEX Review that you can find in Amazon. Okay. And also, I'm the president and the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Now, also, I'm a practicing nurse educator. Currently, I am a nursing faculty in a Los Angeles Nursing College. Okay, so tonight, everybody, welcome. Let's see who we have in the comment section for tonight. So, welcome here tonight, Kadlatu. Okay, so thanks for meeting me here. Okay, nice to meet you here. We also have Atet Shoko Pascual. So welcome to our Facebook Live, okay, on delegation and prioritization. Okay, Emma, welcome also for tonight. Okay, so let's see who's the earliest one to sign in tonight. Okay, so Amber, you're the very first person to sign in tonight in the comment section. Okay, so okay, special shout out to you. All right, and then we also have okay, Uba Ismael. So nice to meet you here also in our Facebook Live for tonight. Okay, so again, without further ado, let's have our agenda for tonight. So the first one is, again, we are giving away 90-day online access NCLEX review that will be for free. Okay, so we will also be announcing at the end of this program our winner for the free 90-day online access NCLEX review. So everybody wait for that. We'll be announcing the winner, okay, who won. So in order to join the contest, you should have joined the session last week, and we put you in the raffle, and then whoever wins in the raffle will be announced tonight. Okay, so you are all automatically going to be part of the raffle next week. Okay, so all right, so everybody, are you ready for our first question for tonight, everyone? Okay, so we will have your first prioritization question. So we have a happy birthday greeting. Okay, so it's my birthday tomorrow, everybody. Okay, so 1 year older, everybody, but not getting older, just getting wiser. Okay, that's what they say. We are not aging, we are just marinating. Okay, so happy to be here after passing my NCLEX-PN last Monday. Oh, congratulations. Okay, congratulations, Wetzel, and thank you for using my book as well. So congratulations for passing. And I think you're one of our students in the online NCLEX Academy as well. So congratulations. Okay, so all right, so we have Amber. Amber says, very, very love your topics, sir. Very specific. Thank you very much for that. Okay, so everybody, let's have the first question for tonight. Okay, so our first question for tonight is all about emergency nursing. Okay, emergency nursing, and this will be ranking the patients according to priority. Okay, so let's have the first question, everybody. Okay, all right. So 4 clients are brought together in the emergency room after a motor vehicle accident. Which client should be seen first? 1. The 36-year-old client who is stuporous and has a pulse oximetry reading of 78%. 2. The 28-year-old client who is responsive and has numerous bruised areas on the head. 3. The 58-year-old client with severe bleeding due to right leg injury. Or 4. The 65-year-old client with a fractured forearm and is complaining of severe pain. Okay? So what do you think is the answer to this question? You have to rank the answers, everyone. And usually this is a common type of question that you will have in the NCLEX, wherein you have to rank patients. You have to choose the most unstable patient, and then you have to rank them, okay, according to your priorities. So always remember, you have your airway, breathing, and circulation. Also, don't forget safety. Don't forget your neurologic status of your patient as well. Or if there is any ongoing infection or risk for infection, that could be also a priority. Okay? So I know all of you are trying to choose. Okay, this is ranking in order, everyone. So you have more than one answer. Okay, so you don't choose only one answer in this question. You have to rank them. So which one comes first and which one will be the last. Okay, so which one comes first and which one will be the last. So you have to choose the most unstable patient to the most stable patient, or you can have four unstable patients, but which patient will be of the highest priority, and then which one will be the last priority in this question, everybody. Okay, so let's see, everyone, what's your answer to the question? Okay, all right. So everybody, so you have a very common type of question that you will encounter in the NCLEX. Okay, so you have 1, 2, 3, 4, then you have to rank them. All right. Sometimes you have 5 choices. Okay. So in this question, everyone, as what I have told you, always remember airway, breathing, circulation comes first. Okay. So in this situation, the answer is going to be letter. Okay. So let's see what's your answer, everyone. Okay, so the answer to this question is going to be 1342. Congratulations for those who got the question right, everyone. The answer is going to be 1342. So number 1 comes first because that is a circulation problem. Okay, circulation problem, you have a pulse oximetry reading of 78%. We're talking of oxygenation here, and oxygenation is one of the highest priorities, or let's say it's the highest priority, definitely. 78% pulse ox. You should understand that your pulse ox is normally 95 to 100%, right? Then the next person after number 1 is going to be number 3, someone with severe bleeding due to right leg injury because that is circulation. Okay, and then number 4, somebody having a fractured forearm and then complaining of severe pain. Okay, and lastly, that would be number 2, which is someone who is responsive and has numerous bruised areas on the head. Okay, now what if we change number 2 to someone who is confused? Okay, alert to confused, then maybe number 2 may not be the last option. It may be a priority because this is a patient who may be having a head injury. Okay, so however, since number 2 you have bruised areas on the head, that could be serious a little bit, a head injury, closed head injury. However, since the patient is still responsive, so meaning that the patient is still doing okay, so that's why number 2 is the last. So you have 1, 3, 4, 2 in this situation, everyone. So everybody got it right, hopefully. Okay, congratulations, everyone. Very good. Okay, if you can also indicate, everybody, from which part of the world you are coming from. Are you coming from California? Are you coming from another state? Or are you coming from another part of the world? So I would like to find out, and then I'm gonna have to give you a shout out. Okay, so very good, everybody, for getting that question right. Okay, so let's have now the next question, everyone. The next question is a very common question. This is actually basic nursing, emergency nursing. So let's find out if you know the answer to this question very well. Okay, all right, so this is our next question, everybody. This is still your emergency nursing, everybody. Okay, all right. So we have Mevis, I think Mevis, I'm still from Minnesota. Congratulations for being here tonight. Okay, from Kansas City. So we have from Michigan as well. So we have a lot of people from different places. Okay, Uba Ismail is from Kansas. Then we have from Jersey also. Very good. Okay, so this is another emergency nursing question, everybody. So you have a client arrives at the emergency room after sustaining an open chest injury due to a car accident. Upon immediate assessment, the nurse observes decreased breath sounds, asymmetrical chest expansion, and a respiratory rate of 23. What is the initial nursing action? A, start the CPR. B, elevate the legs. C, cover the chest wound. Or D, remove penetrating objects. So what will be your priority to this question, everyone? Okay, so this is a patient with an open chest injury. What is going to be your priority? Okay, and always remember that before you call the provider, you always have to do something, right? You always have to do something. So in this situation, what do you think will come first? A, B, C, D. You have to know your emergency nursing, everyone, and your emergency conditions. Especially in this situation, you have an open chest injury. So you have to remember what can happen if your patient has an open chest injury. Okay, what is your priority? Okay, so that's part of emergency nursing. Are you going to cover the chest or not? Are you going to elevate the legs based on the assessment? Okay, so you have to look at the assessment, everybody. You have decreased breath sounds. Okay, so the answer to this question, everybody, is going to be, all right, it's going to be letter C. Congratulations, everyone. That's the correct answer, letter C. So very good. So a client arrives at the emergency room after sustaining an open chest injury. Okay, so the first thing that you have to do, everyone, is that you have to cover the chest wound. Okay, cover the chest wound. You don't necessarily have to start the CPR because this patient is still breathing and he still has a pulse. There will be elevate the legs. You elevate the head of the bed to promote maximum expansion of the lungs, to promote lung expansion. So you don't really elevate the legs because there is no indication of shock in this situation. So rather, what you want to do first is to elevate the head of your patient, and definitely letter C comes first. You have to cover the wound. Why do you have to cover the wound? Because we have to prevent air from entering the chest. That can lead to pneumothorax. Pneumothorax is the accumulation of air in the pleural cavity that can lead to the collapse of the lungs or atelectasis and even to mediastinal shifting. So very important is you have to cover the chest so that the air doesn't go inside the pleural cavity and prevent lung expansion and can cause atelectasis. So letter C is the answer. And one thing to remember as well, everyone, is this, okay? You should never remove any penetrating object in the chest, okay? Because that penetrating object actually acts as a seal to prevent air from entering. If you remove that, air will enter the chest and cause pneumothorax, and that's going to cause positive pressure inside the chest cavity and can cause atelectasis or collapse of the lungs. Okay, so rather you want to stabilize the penetrating object but not remove it. Okay, so the answer is going to be letter C, everyone. Okay, so letter C. Okay, congratulations for those people who got it right. Okay, so now let's have your next question, everybody. Okay, are you excited? Put a big yes. All right. And one of the things also that I would like you to remember is this, or to remind you, is that recently we have posted all of the sessions that we have, video sessions that we have in the online NCLEX Academy. So you can go to our website and start watching these videos. There's a certain fee that you can pay just to watch all of the videos that we have all the way to the start of the year. Okay, so now you have access to all the complete videos that we have for prioritization delegation. And also every month we are adding more sessions as we do this. Okay, so let's have your next session, everybody. This is going to be your delegation question now, everyone. Okay, delegation question. So Erica said yes, a very big yes. Good. Okay, so delegation question, everybody, you will encounter this in the NCLEX. So the registered nurse works together with the licensed practical nurse during admission of a client with quadriplegia due to a cervical spine injury. Which of the following tasks can be delegated to the LPN? Select all that apply. A, discuss the admission procedure to the client. B, check the patency of the Foley catheter. C, perform tracheostomy care. D, formulate the plan of care. E, report abnormal lab results to the provider. Or F, flush the tube fitting with water. Okay? So what's the answer, everyone, for this delegation question? Which ones can be delegated to the LPN? Okay. A, discuss the admission procedure to the client. B, check the patency of the Foley catheter. C. Perform tracheostomy care. D. Formulate the plan of care. Okay. E. Report abnormal labs to the results to the provider. Or F. Flush the tube feeding with water. Okay. So what's the answer, everybody? Okay. What's the answer? Okay. So this is delegation. Delegation, everyone. What do you think is the best answer? Okay, so I think you all have your answer now, everybody. Always remember that the LPN reports to the RN. Okay, the LPN reports to the RN. And this is an admission of a client. So we're admitting a patient. So this is the first time that we're seeing the patient, we're admitting the patient. So, okay, we're admitting the patient. So during admission process, read the stem very carefully, the stem of the question. So the stem of the question says admission of a client, okay? So the answer to this question, everyone, okay, is going to be, all right, so we have letter B, letter C, and then we have letter F, everybody. Okay, so this is the answer, everyone. B, C, and F. Okay, now what is the rationale why it's B, C, and F? Always remember that A is not the answer because A, this is an admission procedure to the client that is the responsibility of the registered nurse. Okay, especially if it's about teaching, explaining to the patient, especially during an admission process. So that should be the registered nurse. So do not delegate teaching. Letter D is wrong because formulation of plan of care, that is the responsibility of the RN. Remember that, okay? The formulation, the revision, or modification of the care plan, that will be the RN. The LPN can carry out certain aspects of the care plan and can make suggestions. However, the formulation, the creation, the modification, that would be the registered nurse, especially when it comes to planning. Planning is the responsibility of the registered nurse. Letter E is not included because reporting abnormal labs to the provider is the responsibility of the registered nurse, especially during admission, okay? Rather, the responsibility of the LPN is to obtain vital signs and report them to the RN, okay? So the RN is the one reporting to the provider, especially in the hospital setting. Okay, so the answer for LPN here, what can be delegated will be checking the patency of the Foley catheter, which is basically part of the scope of practice of the LPN. They can even insert Foley catheter, definitely, perform sterile procedures, wound dressings. Letter C, perform tracheostomy care and also suctioning, that is included. Okay, that's the scope of practice of the LPN. And letter F, flush the tubing with water, of course, because LPNs can even give tube feeding medication. So they can definitely flush the tube feeding. So congratulations, everybody who got this right. So Amber Liu, obviously tonight, is ecstatic because she's getting the right answers tonight. So congratulations. Pat yourself on the back for getting the right answer for tonight. Okay. So never delegate tape. All right. Okay, so congratulations for those who got the correct answer, everyone. All right, so don't forget, LPNs do not report the labs to the provider. Okay, who reports the lab to the provider? The registered nurse. The registered nurse is the one responsible for analyzing, evaluating, and interpreting lab results and also reporting to the provider. Okay? But the LPN reports to the registered nurse. Okay? So remember that, everybody. So are you ready for our last question for tonight, everyone? Okay? All right. So our last question for tonight, everybody. All right. So another delegation question, everyone. Okay. The registered nurse, licensed practical nurse, and unlicensed assistive personnel have been assigned to care for a client with renal colic due to kidney stones. Which of the following is an appropriate delegation of task? A. Asking the UAP to collect urine sample from the Foley catheter. B. Instructing the LPN to administer IV hydromorphone hydrochloride, which is your dilaudid. C. Requesting the LPN to collect pain history data. D. Assigning the UAP to collect all urine for the next 24 hours. Or E. Asking the LPN to assist in the client during ambulation. So which one is an appropriate delegation of tasks? So you have to choose one answer in this question. This is not a select all that apply question. There's only one answer to this question, everyone. So which one is a correct delegation of tasks? Okay, and always remember there's a big difference between assignment and delegation. When you say delegation, the registered nurse retains the accountability for the delegation. Okay, when you say assignment, assignment means that we give responsibilities to the staff, to the LPN, or to the UAP, and it is because it's part of their scope of practice and it is routine. Okay, so delegation means that we delegate tasks and the person who is delegating is still accountable. Okay, so the answer to this question, everyone, I can see that most of you already are giving your answers. Okay, so rejoice if you get the answer in this question, everyone. Okay, imagine you're sitting right now taking your licensure examination and you are analyzing the question very well. Okay, and always remember, guys, later on, if ever you pass your NCLEX, please let us know. Okay, so that especially if this session is helping you out, guys, send us an email or send us a message so that we will know that it's making an impact in your licensure examination. Okay, so let's now have the answer to this question, everyone. Okay, so the answer to this question is going to be letter D. Yes, so D is the answer, everybody. Assigning the UAP to collect all urine for the next 24 hours. Always remember that UAPs can collect urine, okay, and they can also strain the urine. They can collect urine from the Foley bag, but if the urine collection should be sterile or it's a complex task, then we do not delegate that to the UAP. In this situation, letter A is not correct because collecting the urine specimen from a Foley requires a certain technique, making sure that it's sterile, and that's not part of the training of the UAP. So A cannot be delegated. Letter B cannot be delegated to the LPN because we all know that LPNs in the NCLEX are not supposed to give IV medications. If it is intramuscular opioid like dilaudid or morphine, for example, then yes, we can do that intramuscularly. Okay. Letter C, requesting the LPN to collect pain history data. Definitely no, we cannot delegate that because collecting pain history data is comprehensive. So that must be the responsibility of the RN. Do not delegate assessment, okay? Especially initial and comprehensive or complete assessment. Now, letter E is not correct delegation because the LPN can assist the client during ambulation. However, ambulation or assistance during ambulation is best delegated to the UAP, not the LPN. So the best answer here is going to be letter D. Very good. Okay, so I hope you got the correct answer for tonight, everyone. So who got 4 out of 4 for tonight? Who got a perfect score? Okay, let's see if you got 4 out of 4. Congratulations. So put that in the comment section. All right. So before we end for tonight, I would like you to start writing down or thinking, what is the one thing that you learned tonight? I know that we have been doing the same concepts every week, but there should be something that you should have learned tonight, okay? And before we proceed, everybody, okay, I would just like to give a shout out to our online NCLEX Academy again. So it's the most complete, innovative, and interactive online NCLEX review. And of course, the most important concept that we have in the program is to make things simple, fast, and easy, because reviewing for the NCLEX will be complicated. And a lot of nurses, they really want to make sure that when they grab the material, it is something that is easy to understand. So we offer a lot of value in our online NCLEX Academy. And recently, what we have added also is all the sessions that we have here, the Facebook Live sessions, ever since from the start, we put them in one place in the Academy, and you can access it there, okay? Because the one that we have in YouTube and here in Facebook are not actually complete. And in the online NCLEX Academy, you could put some comments, and then I can also respond as well, okay? And we do have handouts there and resources also. So yes, so we also have the workbook, and the workbook is our flagship product. And a lot of students, when they do the self-review, they really get the workbook with that. And also recently, we have partnered with UWorld, so we're now offering UWorld as well as an option for more Q banks. Okay, so that's it. And then of course, lastly, we have the my published book in Amazon. Okay, so we have the simple, fast, and easy NCLEX review. It's now available in the Philippines, and if you want to buy that, you can email Matus Nursing Review academy@gmail.com. That is the email if you want to order in the Philippines, everyone. Okay, so all right, so let's proceed. Now, are you ready, everybody, to know who won in for our raffle? Okay, so who won the raffle? Let's see. Okay, happy birthday. Kikil, thank you very much for greeting me happy birthday. Okay, so that's really a very exciting greeting for me. And thank you very much, okay, for being grateful and thankful also that we are here. So, and okay, so let's proceed. Okay, so we have now our congratulations. Okay, so let's see who won the 90-day free online access. Are you all ready, everybody? Okay, so let's see. All right, let's see, everyone. Okay, so the winner for this week is going to be, okay, so we have Carrie Ann Gordon. So Carrie, you're the winner for this week. So please send us an email so that you can claim your prize. Congratulations, Carrie. Okay, and I would just like to put the shout out, the birthday greetings from me. Thank you very much, everyone. So happy birthday, Sir Alan. Yes, it's going to be a special day. Not tomorrow, everyone. Actually, it's Saturday. Okay, not tomorrow. Okay, it's gonna be on Saturday, everyone. Thank you very much, Denise, also for the greeting. Okay, so I'm gonna be 20 years old on Saturday. Okay, so but anyway, congratulations to Carrie Ann Gordon for winning our 90-day free online access. Okay, so again, thank you very much, everybody, and thank you for all the greetings that you have. I will see you again next week, everybody, for another session. Okay, so sometimes we start late, so just wait for the announcement in the Facebook page. Okay, because sometimes we do have technical issues. So thank you very much, and see you next week, everyone, and have a nice night.